710 News Radio 102.9 KARN. First News, Kevin Miller joined by Dr. Steppe Mette. He's the CEO of UAMS. Good morning, Dr. Mette. How you doing?
Good morning, Kevin. I'm well. Happy New Year to you.
Looking at the numbers that we've seen over the holidays, and maybe more of this coming to COVID-19 numbers in the state, substantially higher than what I think anybody would like to see.
Absolutely. Very concerning.
All right, and with that, too, we're hearing reports of hospitals being overloaded. What's the game plan if this continues? What's going to happen in Arkansas, the safety net?
Well, I think all hospitals, certainly the ones here in central Arkansas and most hospitals that I'm aware of, have what we call surge plans. And that will be the ability to increase capacity of our hospitals, beyond what we normally do. So increasing the number of critical care beds, ICU beds, and regular medical surgical beds. In addition, there's always the ability to start decreasing what we call non-time sensitive or elective surgical care, primarily, if needed. That is rescheduling those cases, and hopefully with the vaccination and ongoing good public health practices, we'll be able to have only a relatively short time period where those surge plans are necessary. I do think that the hospital system, the healthcare system in Arkansas, can deal with the increased demand on hospital beds, but it will take a lot of diligence and hard work to get us through this.
Yeah. Dr. Steppe Mette here on KARN. Dr. Mette, my sister that lives in Malvern, and her husband, my brother-in-law, both have gotten COVID-19, and they've been very careful. They didn't do anything. They didn't do any group gatherings. They just really avoided all that and ended up with it anyway. I mean, it's kind of hard to explain. They don't know how it happened.
Yes, I think that's a demonstration of the fact that the virus is very transmissible, very communicative. So we need to pay attention. It still makes sense to wear a mask, avoid crowds, because that's how the virus gets transmitted from one person to another, maintaining the physical and social distancing, and get the vaccine as soon as it's your turn to do so.
Right. The vaccine, how is that rollout going?
From my perspective, well. So right now we are still in what the Department of Health calls Phase 1A, which means healthcare workers, those that live in long-term care facilities and staff, and now first responders. So at UAMS, and I know that the other hospitals here in central Arkansas, we have vaccinated a significant portion of our frontline healthcare workers. And indeed, by the end of this week, we will have given almost all of our first-line healthcare workers that requested or agreed to have the vaccine their first dose.
Dr. Steppe Mette, he's with UAMS. Yeah, my wife is a healthcare worker, not at UAMS, but she is a healthcare worker, and she's scheduled to get her vaccine today at noon. So, I mean, there, have been some concerns about different types of reactions. Do you think that's significant, or is that just a rarity?
I think it's a rarity, Kevin. We have vaccinated over 4,000 of our employees and have not seen any significant side effect or reaction.
Right.
It's a little bit of soreness in the arm, a little bit of achiness, maybe a little bit of a headache. There are those sporadic reports of allergic reactions, but I've not seen any reports that those are outside of what would normally be expected of any kind of vaccination.
Sure. It's Kevin Miller with Dr. Steppe Mette. Moderna, they talked about splitting the doses on that yesterday, that it might be maybe more doses there if they kind of split this in half. And now there's a report out that says, no, that's probably not the way to go. Do we have any information on what's happening with that particular vaccine?
I don't have any firsthand knowledge other than what I read about in the paper, and I think that the FDA currently is not inclined to split that Moderna dose, and not until there is more information and more discussion at the FDA. So I don't think that's going to happen imminently.
Right. What about other vaccines that are on the way?
There are a number of them. So I think Europe and the rest of the world will see a large percentage of the their vaccines being the AstraZeneca Oxford vaccine, which is a different type of strategy in creating that vaccine. There will be billions of doses this year, calendar year 2021, and we'll probably get some of those vaccines. And then there are 2 or 3 other major manufacturers that their vaccines are in the final stages of their clinical trials. So we'll see those vaccines in this calendar year as well. So it feels like a slow ramp up, but certainly by middle of the year, I think a large percentage of Americans will have the opportunity to be vaccinated.
It's Dr. Steppe Mette here, News Radio 102.9 KARN. What about, the population as a whole, for the people that want to get the vaccine? And I'm curious about this, too, because I see two lines of thought. And I tend to be in the line of wear a mask, be cautious, do the protocols, stay away from crowds along that line. But you get other people that are like, okay, maybe I'll wear a mask, but, we're all going to get it anyway. Are we all going to get it?
Hopefully not. And there's no reason why we have to all get it. Certainly, practicing the public health measures that you just mentioned are the surest way until we all get vaccinated, all have that immunity, or the 90%, 85-90% of the population has the immunity. So it's not inevitable, Kevin. I think there's still the opportunity for us to thwart or avoid large populations, a large number of us getting the infection, but it will take, again, vigilance and adherence to public health policies, masking, social distance, hand washing.
Good information. CEO of UAMS, Dr. Steppe Mette. Great to have you on this morning. Thanks so much.
Nice to talk to you. Bye-bye.
All right.